guys, welcome to our Facebook Live today on healing autoimmune disease naturally in our group. Today we actually have a really big treat for you guys. We have somebody who, I'm going to allow Liz when she comes on to introduce herself, but today we have a real treat because we have someone who's been in our program for 7 out of the 8 weeks so far, and her name is Liz Butler. And I'm going to introduce her in a few seconds. I just wanted to first introduce myself. Some of you are new to the group. I'm Dr. Maggie Yu, and I'm an integrative functional medicine physician, and I've been in practice for 22 years. My first 10 years of it is as a functional medicine my first 10 years as a family practice physician, and I came down actually with early menopause at the age of 36, and I had to really push and fight to get myself diagnosed finally with why was all this happening, and I figured out finally that I had Hashimoto's, which is an autoimmune disease of the thyroid. And I'm just going to go ahead and which is an autoimmune disease of the thyroid. And what I found out in the next couple of years was that that conventional medicine didn't have the answers for me, and I'm a doctor myself. So I had to fight tooth and nail to actually get myself educated and trained on all the different things that it took that wasn't related with conventional medicine to actually help heal and reverse my autoimmune disease. So at the age of 38, I actually came out of menopause. And I've been, ever since, for the last 10 years of my career, been literally an autoimmune disease crusader, fighting for a functional approach that includes taking care of all the triggers that trigger autoimmune disease in patients. And what we have is currently we have an 8-week autoimmune disease program, Healing Autoimmune Disease Naturally program, that's 100% online. And so I just wanted to bring on a real life case study. And this is someone, and I'm going to let's pull Liz on. Those of you who are currently watching right now, if you can tell me where you're watching from, that'd be really awesome, because tell us where you're watching from. And then I'm going to go ahead and, this is a new format we're using. All right, so I'm going to go ahead and pull Liz on. Liz, welcome to our group.
Thank you. So good to be here.
I'd love for you to, you're in week 7 of our 8-week program.
Yes.
And what I would love for you to do is give us an introduction, a little bit of introduction of background of who you are and what you do.
So I'm Liz, and I live in close to Miami, Florida. I'm 42. I have married with 2 kids, ages 6 and 7. So kind of busy, busy stage of life with the little ones. I was in communications. I actually was in my dream job for several years in Orlando before we moved down to Miami, and actually had to end up giving up my dream job because of my health. Trying to see if maybe the stress, because, a dream job can still have stress. Seeing if the stress could eliminate, taking away that stress would eliminate the issues I was having health-wise. So I miss working, but I'm here today, alive and healthy. So that's a good thing.
And let's go over a little bit. Can you give us an idea of how did you actually come about your diagnosis in the first place? So what was the storm of events that happened?
Right. So for 20 years or so, I've had all kinds of just kind of weird, stuff like in my teens, after I would eat, I'd have so much bloating, I'd have to unzip my pants, or like I had issues around my menstrual cycle and all that, hormonal type of stuff, tons of digestive issues. I always felt like I had these low thyroid symptoms. Would get tested. Conventional medicine said, you're still okay. You're not great, but you're okay. I got diagnosed a few years ago with colitis, and tried to tackle the digestive thing, the intestinal thing. But last September, I came down with a pretty bad gut infection that was a SIBO, a bacterial infection, which is a small intestine's bacterial overgrowth. And then also leaky gut and a colitis flare. So the the three of those pretty much brought me down to my knees as far as my health went. So I was being treated here locally by a functional medicine doctor, and I was able to get control of my gut, but I had some symptoms that were not resolving and got a lupus diagnosis. So, and then also a low thyroid, not functioning well diagnosis. So, the diagnoses kept on coming on, even though I had started getting my gut better. Vague, weird, really weird muscle pains. I couldn't get up the stairs very well. We live in a 2-story house. So it was tricky. I would literally feel like I was going to faint when I got to the top of the stairs. I would literally be out of breath, huffing and puffing.
So question, when you say you had the colitis flare, at that time, was it thought that the colitis was autoimmune related, or did you think it was 100% related with the SIBO?
No, because I mean, I've had the colitis thing going on for, I don't know, 4 or 5 years. So I knew it wasn't just the SIBO thing.
So it was 4 or 5 years with colitis, and one of the issues in there was the SIBO. And as you were treating the SIBO, this was how long ago you said about?
September of 17.
So this was 6 months ago.
Mm-hmm.
And as you were treating the SIBO, what happened?
The SIBO resolved. My bloating went down. I have my kids say like, "Mommy, do you have a pizza baby in your belly?" Like I always look like I was pregnant because I always had so much bloating. So the gut stuff resolved, but then like muscle pain came on really strong. Joint pain also. I've never had joint issues before. We have autoimmune all spread throughout my mom's side of the family. So I've heard my family talk about autoimmune stuff and joint pain and all this, but it was the first time I had experienced it.
So you didn't know when, as SIBO was getting better, you're wondering why the heck you were coming down with all these symptoms.
Yeah,
right?
You hear so much about gut health now, and like, get your gut in order and you're going to be good. And I was doing that. And so I was like, why is this other stuff happening? This is confusing to me.
It is confusing. And that's why I want to actually clarify it, because if some of you that are watching are actually have had this pattern where you find that you think you're actually doing better, or as your gut is healing, you may not, your gut symptoms may be getting better or not getting better, but other symptoms started to show up and you're like, what the heck? I'm doing all the right things because you've been eating right, you've been trying to exercise, you've been working on your gut for quite some time, dealing with colitis for 4 years, right? Mm-hmm. So when the question came up, because you were seeing, who are you, what kind of doctors were you working with on the SIBO?
So I decided to go to a functional medicine doctor when we moved down here. I had just heard, conventional medicine. I mean, I had gastroenterologists that told me I could take some drugs for symptoms. The side effect would be death. So wasn't interested.
Did he really say, or she really say the side effect would be death?
Yeah. Uh-huh. Yeah.
It's true though. Some of the side effects of these medications is death or life-threatening cancer, actually.
Mm-hmm. So I was not interested in that medication. I wasn't interested in treating symptoms. I wanted to find somebody who could help me find a root cause and figure out how to heal and not just treat symptoms. So I met with a functional medicine doctor. I mean, I've told you, I've done the conveyor belt of specialists. I've seen immunologists, allergists, cardiologists, gynecologists, gastroenterologists, and all the ologists.
What did the gist say to you? What was the conclusion of all the conveyor belt? And if some of you have been on that, can you give a sad face, just so you can let other people know that you've been on the conveyor belt specialist? Give us some sad faces on the emoji. But out of all the gists, all those years, I mean, you listed 10 gists. So how many specialists that you saw? What was the conclusion of all that? Did it help? What was the conclusion?
Yeah, I mean, a lot of doctors scratched their head. We're not really sure. I mean, some doctors said you're just going to have to treat the symptoms. Some said you can take a chill pill. You might need to.
What the heck is a chill pill?
Chill out. Like, don't worry about these symptoms. This is life. This is common. I was seeing an acupuncturist here in town, a chiropractor as well. The acupuncturist said something that really stuck with me, and that was, something might be common for us, but it's not normal and it's not right. And that's
Yes.
where I was like, you're right. Like I don't want to feel like crap the rest of my life. I want to feel good. I have 2 kids I want to take care of and have fun with. I have a husband that is, a great to me. I want to have fun with him through life.
Well, so what I'm hearing is that you saw a bunch of specialists, gynecologists, cardiologists, endocrinologists, gastroenterologists. But did you fit into any of the boxes, the check box that they have for the diagnosis? Question. That's the first question. Did you fit into any of the check box of the various diagnoses that they have?
Right. Yeah. I mean, I fit into different diagnoses, but our body is a whole, and it interacts. Different systems interact with one another. So treating one system for me wasn't helping the other systems. I had treated the digestive, but it wasn't helping the musculoskeletal. So
what I'm hearing is that you went to the various conventional specialists. You were given various diagnoses, but a lot of the treatment was symptom based on that organ that they were seeing you for, and it didn't solve the bigger problem.
Absolutely.
So then you went on your own to actually go seek out a functional doctor to work on your gut, because everybody says heal your gut, right? You did heal your SIBO, and some of your symptoms in your gut got better, but then things got really worse. Right?
Right. A lot worse.
So a lot of people think that going to see a functional functionalist answer. And what was your experience as you were going to this functional medicine doctor, and who was doing great with the SIBO and your gut? As things got worse, what was your experience with that as far as functional medicine doctor was concerned?
So what I really figured out was that she's awesome with gut, figuring out gut stuff and how to heal that. But when I got the lupus diagnosis, she said, let's go see a couple of rheumatologists. They all have different opinions, and then come back to me and we'll figure out what to do next. And for me, that made me feel like, what, I think I need to find somebody else to help me with autoimmune. I need an autoimmune expert that doesn't need me to jump around to specialist again to figure out what to do next.
So that's a really important distinction that I want to make clear for a lot of people that they don't understand. So a lot of people will say, go see a functional medicine doctor. But the thing is, that's a very generic term, because that just means, a functional medicine provider can be anywhere from someone who's not even licensed in any sort of medicine, to somebody who could be even if you're an MD or a nurse practitioner or a chiropractor and you have a functional medicine training, it doesn't necessarily mean that you're a specialist in the particular area that the patient has. So the specialist that you were working with, who's a functional medicine doctor, is wonderful at gut health, but was not a specialist in autoimmune disease. When things started to go downhill with autoimmune disease symptoms in you, her response was, go see a rheumatologist, right? And
right.
There was, so you started to take matters into your own hands.
Absolutely.
So what was the quest like, trying to find someone who specializes in functional medicine with autoimmune disease? What was that like?
I found you in January, and these symptoms started up like October, November. They really geared up. So I didn't really know what to do. I was looking, but I hadn't found somebody yet that I was really confident with until I talked to you. And then I was like, dang, this doctor knows her stuff.
Well, but I think for me, it was my own journey. It's interesting when you look at doctors like Terry Wall, when you look at doctors like myself, we've actually really suffered. I mean, the reason I went into autoimmune disease is because I actually was a conventional doctor myself, didn't find the answers, and I had to fight tooth and nail and when this happened to me 12 years ago, there's no such thing as functional medicine. It didn't even really exist as a discipline. So everything was really, you're shit out of luck, and anything you do is woo-woo, and you're out on your own. So trying to go through 2 years of training under that to kind of reverse my own symptoms was a fight, was a literal fight. But but the thing is that I think a lot of us that goes into functional medicine is that it's based on our own experience. So if you are working with someone who doesn't have autoimmune disease, and that's not where the majority of the training lies, you're not going to be able to get someone who's focused on that. So let me ask you something. Where are you at now with symptoms? In the last 7 years, week 7 of the program, I want to ask, where are you at right now with symptoms?
Okay, so I'll try not to cry. I My muscle pain is gone. My joint pain, which that was all very new, was gone. I can climb up the stairs and I'm not out of breath when I get to the top. Something that was kind of weird is that I had a candida infection as well. And so with treating that, the sugar cravings were so bad because the candida wanted that sugar to keep itself alive. I have killed the candida and I don't have those sugar cravings anymore. I don't feel the need to run to the pantry and put hordes of chocolate in my face.
One question: did you know while you were treating the SIBO that candida was an issue for you?
No, I did not. And I had done tests that showed that, but I didn't have a doctor that was able to interpret those results.
So accurate interpretation of results, especially based on someone with autoimmune disease, was something that was crucial and different that you have learned over the program.
Absolutely, yeah. And the fact that we're a whole body and we're not just treating a thyroid, we're not just treating ovaries, we're treating the whole body, gets the results. I mean, that's how I am where I am today. I told our group on Wednesday that, I mean, literally, I took my kids to school and brought them home, and I laid on the sofa while they did their homework, while my husband would help with dinner. He would clean up the kitchen. He would read them books and put them to bed. I had nothing. I had no energy. I really had no life. And I told the group this week, hey guys, guess what? I was able to buy a bike and we are biking to school. And that is just huge. I mean, my son said this week, I said, I'm gonna talk to some friends on Facebook with Dr. Maggie because they've seen you. And I said, what would you tell people that's changed about mommy? And they said, mommy smiles now. Mommy smiles a lot. And mommy can exercise and do things. And so it's just life changing. It's life changing where I was and where I am now.
You made me do the ugly cry. You promised me you weren't going to make me do the ugly cry.
No, you're not ugly crying.
You know,
42. I should have a lot of life to live. And I mean, last week I shared with the group that I was able, it's little, but I was able to present an idea of a fundraiser I have for the PTA at our local elementary school. And just being able to like stand up and present again, I was in communications. I'm used to talking in front of people. I'm used to, but none of this stuff has happened. I quit my job a year and a half ago. I haven't been able to work. I haven't been able to do anything. So just to be able to engage my brain and actually like be a functioning member of society, it was super exciting for me. It was great.
I have a question. How do you, what was really heartwarming was, because we, on our masterminds, on our live section of the masterminds, this is a community. And I'm 2 hours a week in your living room, and Frankie's 2 hours a week in your living room. And we actually get to see you guys. What was amazing it was so heartwarming was, I think not this week, but the week before on the live mastermind, you were in your van driving your kids.
Yeah.
And you were like, your camera was on your kids, and you guys were like, what was up with that? That was so cute.
Yeah, they wanted to see you. They know, like every Wednesday and Friday, mommy is going to be, zooming up to school. We only live like less than a mile from the school. Mommy's going to be zooming up there because mommy's on her call with, her doctor and her friend that's helping her learn how to eat the correct way. They wanted to see you. They are so happy where we are.
It's so neat. I was just watching them. They're like, and you guys were all like, yay! Oh, it was adorable.
Yeah.
I want to ask something. How do you think what we do is completely different than just going to see a new doctor for 8 weeks?
So So, I mean, first of all, like I've said, you're treating the whole body. You're treating root causes. And, I've always been a healthy eater. I love to eat. I love to cook. I'm a live to eat person, not a eat to live. I love food. I love veggies. I would rather eat veggies than sweets usually. So I was like, you know what? Before this program, I thought I had that like all wrapped up. And then Frankie, the nutritionist, has shown me so much more about how we can use food really as medicine in treating our autoimmune disease. So that's been huge. Like when you said that we were going to have a nutritionist through this program, I was like, oh, okay, whatever. I really want to your brain, but then having spent 2 hours a week with her every week, I'm like, oh, I've learned so much about just autoimmune and nutrition and how much that nutrition piece really means.
Yeah, it's really interesting. Frankie is who I call my work wife. I have the utmost of respect for functional nutritionists in the role of working with someone with autoimmune disease like myself. I cannot do my job if Frankie wasn't there. And for people who don't know that, they've never experienced it, they don't understand. So I can say that, but to actually hear you say that, I think it reaffirms for people how crucial it is to actually have experts, a team like the doctor and the functional nutritionist who are the actual experts in autoimmune disease to be working with you week in, week out over this period of time.
Absolutely.
And it's interesting that sometimes people will be like, I think I'm looking forward to seeing Frankie more than I'm looking forward to seeing you. I'm like, jealous. I'm like, which?
No, we love both of you guys. I mean, just the team dynamic makes such a huge difference in our progress. And I mean, I could have kept going to all these different specialists, but it would take months and years. It takes 2 months to get into a specialist sometimes, and then you get those results and you head on to the next specialist. And so, I mean, I could have been months and years just living on my sofa and in my bed. And so when you said, hey, we're doing this in 8 weeks and we're tackling all of it, I was like, yes, let's do this. Let's do this in 8 weeks. And
I love it. Okay, go ahead, finish.
No, I was going to say, I sat there in week 2. I mean, some of the stuff we're doing, it takes time to see results, our iron and stuff like vitamin D, they just don't change in a week. And I know this in my brain, but in my heart and emotionally, like at week 2 and 3, I'm like, well, I just don't know if this is going to work for me. This might be working really well for other people, but I have already done all these specialists. Maybe this is just another thing that's not going to work. And now here I am at week 7 and I'm biking to my kids to school. It worked.
And I remember one of the things that you said was, I remember like week 2 or 3, you felt like it wasn't coming fast enough. Like you were thinking, there was a fear about it, maybe a little bit like, was it sugar that you were really struggling with?
Yeah. I mean, once we started tackling that candida, the sugar was just, I wanted to eat it all the time. And that's not really how I was before.
Feed me.
Yeah. Yeah, I'd rather eat veggies than sweets. And all of a sudden I'm like, woo, look at all those carbs. Look at that candy. I want that.
Question on you on that is that, as far as food mapping was concerned, you were working with a functional medicine doctor that did a lot with healing your gut and with SIBO testing. How did you have food mapping done before?
I did not have food mapping done before. I had the whole allergy because I was working with an immunologist and allergist. So I had the whole workup of allergy stuff. I had some blood work run, some IgG tests. I guess there's different ones. You're the expert on that. But didn't really have, did not have correct interpretation, but also the food mapping brought up some interesting things that I needed to stay away from that I didn't know about. And I've been dealing with gut stuff. I've done the FODMAP diet. I've done that off and on for years. I've done most recently the SCD, the simple carbohydrate diet. So I've done all kinds of elimination diets. I have been gluten-free for 10 years. There was a time when I was dairy-free because years ago, like 15 years ago, because I thought it was dairy. So, you're playing all these games, like trying to figure out what is it, and you can do all these eliminations and still not come up with answers, because sometimes it's days before you feel the reaction. That's what I share, with friends who are like, well, how would you not know what's going on? Well, that's because it's not an allergic reaction. I don't see it in 20 minutes or 1 minute. Sometimes it's 3 hours. Sometimes it's 3 days before I see something come up. And then what was it? But how much food have I eaten over 3 days that I don't know? Like one of my things that came out was sesame seeds. I would have no idea. No idea.
I think I used you as an example, some of your results, because this is what I find all the time, is that people in this group and the vast majority of people with autoimmune disease that I work with have been on some sort of elimination diet, because that's what you read, and you do, and you try to piece this together yourself. But the problem is that in all, you could be doing AIP, FODMAPs, GAPs, you could be doing, anti-inflammatory diet. But the problem is, if you've never had food mapping done, what you're thinking is healthy, which is costing you a lot of effort, time, money, putting your family through all this, it makes food a literal war zone. But without the actual food mapping done, you didn't know some of the healthy stuff you were eating was actually triggering and continuing this colitis, SIBO, and candida to continue.
Right. And when I had done the test, the reason why I knew I had leaky gut was that I had so many things light up, and then now I only have a few things. And so it's when I got my results, some of my results were a little bit sad, but I really wasn't. I was excited. I was like, finally, I know what foods I need to stay away from. Finally, I'm done with having to do eliminations.
So clarity with food. That's my thing, is I'm not, so your typical functional medicine trained doctor is going to tell you to go on an elimination diet. Okay. Mm-hmm. Period. And so for me, it's like, I'm very much against the grain on that, because that's from my own experience in autoimmune disease. So in the realm of autoimmune disease, life and food is so hard already. And without actually, there's a simple blood test here. There are people like myself and Frankie who actually specializes in interpreting these results. We can give you 100% clarity with what you should be and shouldn't be eating, with blood sugar in mind, with your food intolerances in mind. And it's stuff you can't figure out. Because how would you, I'm just going to ask you, how in God's name are you going to figure out that sesame seed was a problem?
Never.
If your reaction over hours or days later.
Never. And it was so funny too, because the day I got my results, it was in the afternoon, and I'm like, ooh, sesame seeds. Oh, well, I don't eat sesame seeds that much, so that'll be no big deal. Meanwhile, that morning I had coconut, right? I had these little coconut chips from Trader Joe's that have sesame seeds on them. And then I had some kale chips that were covered in tahini. I had at least 2 or 3 servings of sesame seeds. It was like, oh, okay, well, I guess I do eat sesame seeds, and they're out now.
Yeah, and the interesting thing is, for me too, it's not about I think there's also a whole aspect of reintroduction. For me, it's not just you do this one test. I think for any of you that are hearing this food mapping conversation, please go back and watch my video under food mapping. Just Google it in the group. I have a whole video of food mapping. The problem is a lot of people say food mapping or food intolerance testing, which is part of food mapping for me, is bunk. And the thing is, it is there are tests out there that are bunk. Number one, there are bad tests out there. Number two, there are providers that have no clue how to interpret these results. Okay, so they don't understand that there can be false positives and false negatives, especially in someone with autoimmune disease. Okay, mm-hmm. So be wary, guys, of getting this done with just anyone, because if there are false positives and false negatives, and that's happening, and you don't know what those are, then you think the whole test is bunk and that the data is no good. Okay, and how many people, when you're going through the program, part of the whole program is teaching you guys how to interpret these results yourself. It's not just about you're going to be with Maggie and Frankie and we're going to dole out your interpretation. You have really learned how to interpret these results. If your kids were to get it done, right now you'd have a really good idea exactly what the results really mean. Better than probably anyone you went to get the test from.
Yes, I mean I had specialists reading results with food, and they read it wrong, and it wasn't the right test. So I mean it was just wrong all the way around. And now if I had my kids run a reliable test like you use, and you've taught us how to interpret those results, I know exactly what my kids would be able to eat and not eat. And we totally want to do that, because I am, like you've taught us, when the mom has autoimmune, there's a good chance my kids are going to have autoimmune. My mom has autoimmune, so I don't want my kids to end up in a situation like this.
And it's so interesting. Tracy Michael just had a comment. She says, if I go any more free, I'll be eating and drinking air.
I could so relate. I mean, there were times where I walked through the grocery store and I was like, what the heck am I going to buy? I am in a grocery store and I don't know what to eat. There's nothing here I can eat. I totally feel you, Tracy.
It's crazy. It's true. And the thing is that, and that's why for me, it's like the whole, people are saying, which diet should I follow? Sometimes people will come in and they'll just post like, should I be on FODMAP? Should I be on STD? Should I be on this? Should I be on that? And I'm like, guys, you got to be thinking about the whole solution here. I mean, for me, like, it's really big. One question I want to ask you is, if it was just food mapping alone and you didn't actually deal with the candida, the blood sugar, and the hormones, we haven't even talked about hormones.
Yeah.
I mean, all these pieces of the pie to actually, this turnaround didn't happen because of one thing. This happened because every piece of the pie in our program, the 5 pillars of our program, is covered during this 8 weeks. If you guys don't know what the heck I'm talking about, I'd love for you guys to jump over to healingautoimmunediseasenaturally.com and go ahead and watch the online training that I do. And in it, there's a pie chart. That's like the holy grail of our program. And take a picture of that. That is the most photographed freeze frame of the entire training, is the pie chart of what I call the holy grail of reversing autoimmune disease. And it's absolutely everything that we cover in the program. And so for me, it's not just about the food mapping. So a lot of people will be like, oh, where should I get food mapping then? Well, I'll tell you right now, nobody does food mapping the way we do, period. Because they don't do the right test. They don't know how to interpret the false positives, false negatives in autoimmune disease. And number 3 is they don't really know how to implement it really well in someone with autoimmune disease. Keeping things in mind like blood sugar, infection like candida, those kinds of pieces of it. There's a lot of layers of this. It's not just about the one test. And so let's talk about hormones. Okay, people don't even think hormones are related with autoimmune disease. And have you had your hormones ever addressed prior to entering this program?
No, I mean, the only time I dealt with hormones was when I was going through infertility treatment. My doctor there ran some numbers, so that's when I got my diagnosis of PCOS. But beyond that, I mean, he got me pregnant. Thank you, God, for that. But beyond that, no. I mean, I've been to 2 gynecologists. One was my favorite doctor in Orlando. Love her. But she told me the symptoms I presented to her, well, that stinks, that your 40s are going to suck.
Thank you.
And then the doctor down here was the doctor who told me to take a chill pill. Yeah.
What have you learned about your hormones, girlfriend?
I mean, now, yeah, I totally learned that the hormones are playing into what's going on with my body and my symptoms. And so, yeah, we're getting control of that. And I've only been like maybe 1 week on treating the hormone stuff, and I can already tell a difference. And you told me it's going to be a while because we're doing a more natural, treatment on that. So I'm like, dang, in a month or 2, I'm going to be feeling like Superwoman.
We're going to have a super hot woman alert in a month or 2.
My husband's going to be like, thank you. Thank you.
I was going to say is that my question was, we absolutely test hormones and we test adrenals in our program. How has it been like for you learning to actually seeing your results and learning how to interpret them accurately?
Oh, it's huge. I mean, it's so huge.
Yeah. Mentioning, what are you currently doing to actually treat some of your hormone imbalances? There's a couple patterns that are really common in autoimmune disease for hormone disturbance in women and then in men as well. And
Yeah.
you definitely fit one of those patterns. And what are you doing actually to treat it right now? Because they want to know. They want to know, what are you having?
Yeah, so I had really low DHEA, and then I also had a cortisol issue where it was like spiking. It literally spiked off the charts, which I'm actually getting used to being off the charts. I've had so many results come back off the charts, and so my cortisol was off the charts in the morning, and then it kind of dipped down later in the day. So we're doing herbal stuff. I do like drops under my tongue and take a couple of different herbs that they work.
And you're learning diet pieces too. There's huge, and balancing your hormones, a diet is huge.
Absolutely.
It's not just about this Band-Aid supplement.
Right. No, it's not just that at all, for sure. The blood sugar thing is huge. I was introduced to blood sugar stuff when I was diagnosed with gestational diabetes, with both of them. Yeah, with both. And so you go through the diabetes program and you learn how to take do your glucose testing, and you learn how they tell you how to eat. But now, like I said earlier, like we've taken that eating thing to a whole nother level. And so I'm sure that's playing into the hormones, because before we even started treating the hormones, I've gotten rid of the migraines that normally come once a month. And that's before we even started treating the hormones.
Because you were already treating with blood sugar.
Huge. It's huge. It's not just about popping pills, that's for sure. Whether it's a prescription or it's an herb, you can't just pop pills and feel better. It's the whole thing, the whole package.
Yeah. I think for those of you who haven't watched the online training, please hop to the healingautoimmunediseasenaturally.com and watch the training, because I actually go through all these different pieces. So, and you can rewatch this as well. But I methodically go through what are the pieces of the pie in the online training. But Liz, I want to ask, we're going to start wrapping up soon, but one of the things I want to find out from you is that it's a lot of people, what do you think is the mindset? Because why is it our team talks to over 100 people a month, and we invite about 20% of that into our program. And the reason is that I am so committed to the outcomes that the people in our program get that I'm very selective about who are the people that are going to be in this program. I say this over and over again, but the people in our program kick ass, take names, and chew bubble gum, right? And that's who gets the outcomes. But I want to ask you something, which was that, what do you think is the difference in the people that are in the group that actually totally changed the trajectory of the autoimmune disease? Because you're not the only one in the program getting these outcomes. I mean, everybody. I mean, I'm actually going to be bringing on other case studies. What do you think is different in the mindset of people who are in this who get these different outcomes? What is the mindset that's different, and what do you think people need to change in their mindset? So what is the different mindset in the people that are in the program?
Definitely the people that are in the program that I have the opportunity to see each week, they are decisive. They are ready to do this. They're over it. A lot of them, they've hit rock bottom. I mean, I wish I didn't have to hit rock bottom to do what I'm doing now. I wish I never had to have ended up here, because there's no idea. I mean, there's a ton of stuff we can reverse, but some stuff you can't. And so, if I could have done this a long time ago, I so would have. But the being decisive and deciding, you know what, this can get worse, like as in I never get off the sofa, or I die, or I can do something about this. Like, there are answers, and I can do something, and I am going to make that decision, and I'm going to put everything into it. I mean, when I joined 8 weeks ago or 7 weeks ago and said, I'm doing this, like I even posted on Facebook, I told my friends and family, like, I am in this for the next 8 weeks, and I am doing this all the way, 100%. You may not see me for 8 weeks.
I actually saw that post recently that you actually did to your family and friends. It was like, here's what I'm doing for the next 8 weeks.
This is it.
I actually told everybody that.
Yes, yeah. I mean, I was in 100%. So you got to be decisive. You got to be ready. And then you've got to have that belief. Like the people that are in the group have the belief that they're not stuck here. Like we're going to do something about it. We have experts here that are experts in autoimmune and they are going to help us do this. And so, I had been looking for someone who could help me. I was one of those ones that I'm decisive. Like I want to do it. I want to feel better. So as soon as I found you, we had one conversation on the phone and I was like, yes, we are doing this.
Oh yeah. Your attitude is it's crazy decisive. You're decisive and you commit. And number two is, what's interesting is you literally burned your boats, meaning like you said, I'm going to do it and I'm actually going to hold myself accountable. I'm going to let everyone in the world know this is what I'm doing. Like you're not, you're like, hold me accountable. Like everyone, this is what I'm doing. But the belief part, I think is really important is that many people out here, and you could already see in some of these comments, is that people think that this isn't possible. This can't be real. And my question for you is that how much evidence do you need to have in front of you that this is happening every single day and it's real? And the truth of the matter is, if you don't believe it's real and you don't think it's possible for you, no one can make that happen for you. It isn't possible.
Yeah.
And that's a mindset issue.
My husband and I were talking about that last night because I have friends and family that would totally benefit from something like this, but they're just not ready. I don't think they think it's possible. But I want to be here to tell you guys that it's totally possible. It doesn't make sense in conventional medicine, but it is possible.
And what's cool for me was that some of us have gotten to the place where we realize that bumping up against the walls in conventional medicine approach, that either we don't want the meds, or we can't tolerate the meds, or the meds themselves didn't produce the result. And some of us have no choice and we have to move into this realm. But it's awesome that you had choices and you were diagnosed with lupus. You could have gone on some heavy hitting drugs and you made a choice to decisiveness with the mindset that this is absolutely going to happen, and you held yourself accountable, letting everyone in the world know, and you invested in yourself and your new outcome. You really did. You're like, I'm worth this and I'm going to do this. There was nothing in you that was like, and you have a very supportive partner as well. Mm-hmm. It's really amazing when I see that people have families that are very supportive, or they themselves have the mindset that I am going to make this happen and I'm worth it, And because, when you first joined the program, what do you think? We haven't talked about this, but what was your husband's response to you joining the program?
He said, if you think this is going to help you, then you do it. You do it. Then you don't look back. You go.
And I'm on the phone.
I really called him the next day on the phone and was like, thank you. Because I know there's spouses out there that they probably are in an argument,
they are
on taking this approach. But yeah, I got an amazing one.
I don't even know if I should talk about this, and I'm going to ask the people in the program, but we talk to people and their spouse a lot, because we don't have this conversation about a program without a spouse present. Because the truth of the matter is that I feel like when someone enrolls in the program, it's not just them that's enrolling, it's their family and their spouse. And I've had people in the past who enrolled despite the protest of a spouse, and it never turns out good because they don't get good outcome because they're fighting members of their own household. And number two, you sometimes have an angry or controlling husband giving us a call later and saying like, why the hell did you do this? And I don't want to get into the middle of that kind of dynamic. And that's why we've become so choosy about who we have in this program. But I'm going to ask you guys something, which is I have an example. I have this belief, and it's from experience of talking to literally thousands of people in the last 10 years, which is that the outcome, like I will have two women, like I'll have Liz Butler 1 and I'll have Liz Butler 2. And Liz Butler 1 will get amazing outcome in her autoimmune disease, and Liz Butler 2 won't have amazing outcome with the autoimmune disease given the same program. And I'm going to ask you guys, do you know the only difference between these two people are? And it's a quiz. If you guys can guess, what do you think is the difference between Liz Butler 1, given everything the same, and Liz Butler 2, everything the same? The major determining factor of why one of them is successful and one isn't. If you can think about what that would be. And I'm going to go ahead and give you guys the answer. Okay. Do you think you know, Liz?
I know.
Okay, tell me.
It's mindset. It's totally saying, you know what, I can do this. I think it's mindset. Like, you talk to us almost every week about mindset and something about mindset. And it's like, the best counseling session that I can go to. I mean, we've been through counseling, my husband and I, so that we can have the best marriage possible. And a lot of the stuff that I've learned in counseling, you have repeated. So you know your mindset stuff too. I mean, there's got to be a certain, so many of us have dealt with being a caretaker or being responsible for stuff way before we should have ever been responsible for stuff, or going through guilt and going through shame. And some of that is tied, or if not all of that is tied to autoimmune too, is what I've learned from you. And it totally makes sense. So yes, we have those pillars that we deal with, like blood sugar and nutrition and infections and all that, but there's mindset. It's what's going on in our mind that's going to make a huge difference in our.
That's really key to actually. You're right. I do think mindset is huge, and and you're right, and that's why we cover that in the program every week. It's something that's really covered, and it's from real life experience. What I found in a major piece of mindset is I know Sandy wrote here support, and Laura wrote support, and that Laura wrote mindset. Lisa and Sandy wrote support. They're both in the program with us currently, and that's something we do talk about, which is that regardless of whether it's a spouse or it's a family member, and if you don't have those friends as well, is that to have the right support in place to actually support you as you go through this program is really key. And the key factor that determines the two key factors you guys have named it both is, number one is this person coachable in terms of their mindset, willing to change, okay, willing to grow? Are they going to say, I'm worth it? I'm worthy of investing in myself. I am decisive. I'm sick and tired of this. And I believe that the result and outcome can absolutely be different. That's the mindset piece, right? But the second piece is support. And I'm going to talk about that. The only difference between the Liz Butler sometimes that will excel and the Liz Butler that won't is a supportive spouse. Or family member. And I have talked to so many, it's heartbreaking sometimes, but I've talked to so many people where, I'm going to give you guys an example, okay? I was speaking with a lady with rheumatoid arthritis, and her husband was on the line as well. And she was kind of sing-songing about what her rheumatoid arthritis was, because it wasn't quote unquote that bad. And I asked the husband, I said, hey, I'll just say his name's Ray. Hey, Ray, so how has it impacted upon you that your wife has rheumatoid arthritis? And he goes, I don't even know she has rheumatoid arthritis. It's wonderful because it doesn't impact me at all. I don't even know she has it unless she says it. She's a really cheerful person and she takes care of everybody. I don't even know she has it. So it's really not a big deal at all for me, right? And then she says later in the conversation, she says, oh yeah, when I wake up in the morning, I'm crawling on the ground to the bathroom. And I said, crawling? And she's like, yeah, I'm crawling on the ground to the bathroom because I'm so stiff and in pain in the morning. And then she goes, but it's before Ray gets up. He's a really heavy sleeper, so he doesn't see me crawling to the bathroom. And he gets up about an hour or two after me. So by that time, I already have breakfast ready and everything. So he doesn't even know that, that. And then I was like, wow, Ray, how does that make you feel to know that she's been crawling on the ground for the last 3 years every morning with her rheumatoid arthritis in pain? He's like, it's great. I don't even notice because I have breakfast ready when I get up. I'm serious. I mean, so for me, guys, it's really, I think it's important to have a supportive spouse, but at the same time, you got to be your own advocates. And the next sentence she said was, oh, we have a wonderful marriage and we're always happy and, and whatever. But you understand here is that she's not being honest with herself, and she's also not being honest with her spouse, and her spouse isn't honest with himself. He's just taking the happy-go-lucky exit route and not even acknowledging the level of pain and suffering that she's in. So spouse is interesting. The family mindset is very interesting. So what I'm trying to wrap up here is this, is that, guys, amazing outcomes are totally not just possible, it's happening. And Liz is not the only one. There's many people, and I'm going to bring on more and more case studies. If you guys have enjoyed this case study, can you guys write in the comment section more case studies? I'm happy to bring more people on so that you guys can understand that this is absolutely real and possible, and what it takes to actually get this to happen. There's a how-to we just went through, and it's not going to be a simple Band-Aid answer. It is the whole solution. That is what I'm about. That is what our program, Healing Autoimmune Disease Naturally, is about. So I'm going to list the link to it. Just go ahead to healingautoimmunediseasenaturally.com, and you can register to watch the online training, and you can learn about how all this is totally within like 2 millimeters away from you. It's just 2 millimeters away. Liz, thank you so much for coming on.
Oh, thank you so much for having me.
That's so brave.
Oh, you know what? If I can share and I can help someone get from where I was to where I am now, I am more than willing to share it with the whole world.
Thank you.
Thanks.
You guys, thank you. And we're ending this. Give us some hearts, give us some wow faces. Just give Liz some love. And I really appreciate this. And nothing else. Her message and my message is at least go watch the online training and understand what the Holy Grail is, and take a picture of that photograph of that pie chart and know that that's what it's going to take, guys. Not a Band-Aid approach, the whole pie, the whole enchilada. All right. Have a great day, guys. Thank you.